Okay, before we get things officially started with the folks here at the tables, Dr. Gold, Chancellor of the University of Nebraska Medical Center, would like to say a few words about the last 3 weeks. Dr. Gold.
Thank you. Well, ladies and gentlemen, Nebraska 1, Ebola 0. That's not an original quote, by the way, as you'll probably hear in a few minutes. Well, we all know that we are here to celebrate a milestone, both for our patient and his wonderful family, but also for the staff members who cared for him over the past weeks since September 5th. This is indeed an amazing accomplishment, and I'd like to take this moment to publicly thank Dr. and Mrs. Sacra and their 3 sons who are with us today for entrusting us with their care and for the opportunity to get to know them as a remarkably courageous and at the same time humble and grateful family. Ladies and gentlemen, it truly takes a village to make this type of event possible, and I want to thank all the members of the patient care team and the biocontainment unit who put in long hours in very stressful situations, who handled themselves in an exemplary fashion, and who are clearly dedicated to the future of healthcare in our community and setting the standards for the world. I want to take this moment to also thank all of the others on campus who continue to perform all of their jobs, our faculty, our students, our staff, and for putting the fears of others that visit our campus on the back burner and getting us focused on what we really do, which is provide world-class health care. I'd like to thank those in the research and in the clinical areas, as this partnership exemplifies the very best of academic medicine to provide this type of medical care. Special thanks to those in the Douglas County Health Department, the Nebraska Department of Health and Human Services, whose interaction and support over the last 3 weeks has also been exemplary. I'd also like to call out the State Department, the Centers for Disease Control and Prevention, and the World Health Organization, who have enabled sharing of information on this virus so that we can not just provide exemplary care here, but we can share that information across the United States, in West Africa, and around the globe. Also, a special thanks to our broadcast and print media colleagues who are with us this morning, who worked so closely with our team and always respected our patients' families' privacy. That does not go without being recognized. And lastly, thanks to the people of Omaha, Nebraska, the people of our state and of our region whose support we have seen online, in the media, literally millions of tweets, emails, and blogs, whose pride and confidence in what we have done together is not by any means unnoticed. During this episode of CARE, we learned a great deal from a medical, from a nursing, from a laboratory, from a public health perspective about the treatment, the diagnosis, and the prevention of this disease. These lessons will help many. Great academic medical centers have a tremendous impact on their community, our country, and around the world, or as we like to say, serious medicine, extraordinary care. Before you today is joined together is Dr. Sacra and his wife Debbie, Dr. Phil Smith, the medical director of our biocontainment unit, and Dr. Angela Hewlett, associate director of the biocontainment unit. Also seated in this room are literally hundreds of members of the biocontainment unit staff. Thank you to all of you. And it is now an incredible, not only institutional pleasure, but an incredibly great personal pleasure to introduce to you Dr. Rick Sacra, who will start off our conversation today. Dr. Sacra, the moment is yours.